I am Kath Snell, the new CEO of Shelter WA. I've certainly met some of you, so it's great to see some familiar faces and also to put some faces to names. This is the start of my third week at Shelter, so please bear with me as I am on a pretty steep learning curve. Learning all about what's going on across the housing and homelessness sectors, as I'm sure you can imagine. So the reason why we're here today is for me to talk you through this pretty fabulous funding opportunity, actually, that you might have heard about. And there's been some changes to the criteria, which I think make it much more accessible for the sector. So I'm just going to go through a little bit about the funding. Before I start, I would like to firstly say that this is being recorded, and I would also like to acknowledge the traditional custodians of the land on which we're meeting today. For me, it's the Whadjuk people of the Noongar Nation, and I would like to pay my respects to elders past, present and emerging, and also give a personal thanks for always feeling welcome on this land. Okay, so we might just kick off. So people will be joining as we go, I think, and that's great. But as I said, we are recording, so we can send this out later. So the scheme that we're here to talk about today is the COVID-19 health response funding that's available. It's funding that has come through to us to distribute by the Health Department. And it is to support the housing and homelessness sector in coordinating and managing COVID-19 health responses. So the expenditure of funding, which organisations can apply for, must be for activity related to the support, treatment and/or management of COVID-19 for people experiencing homelessness or housing insecurity. Services or organisations must have a current government contract. However, there is some leeway here because we realise that not everyone has an ongoing government contract. So if an organisation is recognised and known and credible, then as a provider, they will be considered. Non-shelter members are also welcome to apply for the funds. Funds are to be spent within WA, and we've got a pretty tight timeline, so please get your applications in soon. It's for expenditure from June 2022, so you could have already spent some money and give us the receipts, up until the end of December this year. We have over $700,000 in the fund, and each organisation can apply for up to $80,000 out of the funding. But it's very much a sort of first come, first served. So once it's gone, it's gone. And if any applications after the 31st of December won't be considered because the grant will be closed by then, or the scheme. So I'm just going to stop there and see if anyone's got any questions before I talk a little bit about what you can apply for. Everybody happy for me to keep going? Beautiful. Okay. So the scheme is available on a reimbursement basis. Funding will be allocated through three main streams. The first one is costs incurred in direct response to or for the immediate treatment and management of COVID positive cases. So claims in this first stream may cover equipment, accommodation, staffing hours, health, wraparound services, and anything that was purchased or provided to support a vulnerable person with COVID-19. The second stream is costs related to the coordination of an improved COVID-19 response. So this is very much around sort of future proofing for potentially COVID coming back through. So that might be help to manage ongoing demands for an organisation, or as I say, future outbreaks. The third stream is around costs for COVID-19 in relation to communication, education, or training materials, such as the delivery of COVID-19 infection control programs to staff or facilities. So in terms of each of you as organisations, there's no limit to the number of times you can claim, but it is a maximum of $80,000 per organisation. So you might put something in today for a $10,000 reimbursement. You can put something else in next week and the week after. As I say, as long as it's up to $80,000 per organisation. The things that are not eligible for this fund are services that are already covered either fully or partially by the Medicare benefit scheme or other Commonwealth programmes. Services provided obviously must be genuine additional costs and not just a relocation of existing services. Mental health specific services are deemed out of scope. And any funding that is spent outside of Western Australia must receive some prior consent. So the preference is, as I said earlier, that all spend is within WA. So just to give you some examples of the kind of things that you can apply for. So COVID-19 care packs. So some of you might have distributed care packs over the last few months, or you might plan to. So bear in mind that you can either put this through as a reimbursement for things that have already been paid, or you can put in an invoice to be able to cover things like COVID care packs, that'll go out at the next potential wave of COVID. Any sort of device or enabling technology for your organisation or for individuals that you might support. And that's particularly around supporting people in times of isolation. Essential clothing, sleeping bags, blankets, etc. Any sort of lifestyle recovery and isolation advice and support. Related pharmaceuticals, transportation that would take people to an isolation location, accommodation and related support, and staff coordination. Some other things that you might want to consider are auditing facilities, so review of your infection control policies and procedures for COVID-19, education and training programs, upskilling of staff and improving responses and management of COVID-19 and other infectious diseases. So I think we all know when COVID hit, everybody was sort of playing catch up and trying to put all of their policies in place and make sure we could survive through it. This is the time for us to look at what else can we do or do we need to do to improve those processes. And this is where this fund can support. Any educational resources for homelessness sector in relation to COVID and any outreach delivery of educational programs, resources to people experiencing homelessness or housing insecurity. So it's a pretty easy process. I'm really encouraging you all to apply for what you might need. Everything's on the shelter website. We would need a copy of your organisation's constitution, details and dates and location of where support was provided, or if you are future-proofing your organisation to better respond to COVID in the future, then an invoice start date and end date. The number of people impacted or services and their age range, services being claimed on amounts, bank details for reimbursement and invoices to upload as supporting evidence. So it's pretty simple, to be honest, as funding applications go. And we're just coming to the end of all the information I have. This particular fund, I think, is of huge benefit to the sector. If you've got any questions or comments and I can't answer them immediately, I'd be really happy to take them and make sure that we clear with the Department of Health. Sorry, my phone's ringing in the background. And to make sure that I can get back to you. But at this point, I just want to stop and see who has any questions or comments that they'd like to make. Cannot see any hands up, but my screen is doing something a little bit crazy, so I'm just making sure.
We've just had a question in the chat from Sandra. Is there an audited or unaudited acquittal required for this grant?
Yeah, that's a really good question. And my understanding, and Kika, you can jump in here because you've been working on this longer than I have, is it's the department want very simple processes. They're looking for receipts, and they're looking for or an invoice, around what you are going to spend, and then we would ask you for your receipt once you've spent it. The grant application itself on the website outlines where the money will be spent. My understanding is it isn't much more than that. Kika, did you want to add anything?
No, I think that pretty much covers it. There's nothing specifically that we require from organisations besides that that evidence of expenditure. Just that invoice or that receipt to prove that the money you're wanting to claim is actually for the thing that you're claiming. We've just had another question come in as well. Is there leeway on backtracking equipment purchased prior to June?
Yeah, thanks. At this point, I'm going to say no, but I'm really happy to follow that up for you. Cool.
That would be really good because I suppose COVID happened way before June 22. So all our services spent a lot of money on equipment and prior to then. So I suppose in looking back and trying to track back, because this would have been great a year ago. I know. It would, it would be good if we could backtrack even from the start of 22.
Yeah, I'll check that. I did ask that question when I met with the department last week, and they sort of reiterated that when the funds were sort of applied for, and when we looked at what the scope might be, it was from this financial year. But I'll see if I'll have that conversation. I'll get back to you.
Beautiful, thank you.
No problem. Anybody else? Is this all sounding fairly straightforward? I really encourage you to apply. I don't want to have to give this money back. I want it to go out to the organisations that need it. I think it's a really good way for us to, pull in some costs that have already gone out, but also do some of that planning that none of us have had the chance or money to do in looking forward. So I really do encourage everybody to apply. Yes.
I just have one more question. Actually, we've got another organisation that we already claim with like a way cost. I'm not sure you heard about that. They've got this thing as well. Are we able to claim with you guys again? Because I'm not sure we already claim with way cost already.
Yeah, sorry.
Yeah.
So Waycross does have a similar fund, but they're very specific on what you can claim for. So the Waycross fund, I believe, is specifically for cleaning. So if you've already claimed, obviously, from one organisation, you couldn't claim the exact same thing from us. But this funding is much broader in what you can apply for. So if you've had a couple of things that you've expended money on, maybe the cleaning could go through the Waycross funding, and everything else you could apply for this funding.
I just want to add quickly to that people have made a note that the Waycross cleaning program is only for external cleaning services that you've employed in. So if you're not eligible for that, then it would be really great to come through this funding, because you can you can claim for other services besides just the external cleaning services that have come in. And you can also claim for equipment and the cleaning products and so on that you can't, and the PPE equipment that you cannot claim through the WACOS cleaning program.
So I just want to make sure everybody's got enough time to process what we've gone through today. I might have broken my own record from making an hour-long meeting 20 minutes. But hey, short meeting, good meeting. So
can I just add something?
Yes, please do, Elizabeth.
Can I just clarify for everybody, Kika or Kath, that people can get a quote for goods related to COVID or whatever and send that through, so they're not actually spending the money up front and then get reimbursed that way? Is that correct, or am I incorrect?
No, that's absolutely correct. So that it would need to be in the form of an invoice. So you can show us that you've got a quote and then invoice us for that amount. So that exactly as Elizabeth says, you're not spending the money before you know if you're going to be approved or not, because we'll then be able to say to you, yeah, this is approved and here's the money for you to purchase it. And then all we'll need off you is a receipt. So I'm just reading what's in the chat.
I think that maybe I've just read the message and I'll just read it out loud because I don't know if it will come up in the recording. I recall that the funding had an auditing arm to it. I also seem to recall that the project officer was going to be around different services to offer the support. Is this still being done? So I think that this might be getting mixed up with Elizabeth's infection control program, because both things, so both this funding scheme and the infection control program were kind of promoted at the same time. Yeah, so that is actually separate to this funding scheme. But if, I mean, Elizabeth, if you want to talk on that, you're more than welcome to. But yeah, it is actually separate to this, if that's what you're thinking about.
I'll just quickly add that if you wanted an audit with regards to infection control, particularly looking at your COVID procedures and policies at your facility or organisation, you can get in touch with me, and that's via the Shelter WA website as well. But we did promote them together, and that's why I think there's been some confusion.
Okay, thanks Kika, thanks Elizabeth. So I hope that's answered that query. Okay, so what I'd recommend everybody does is jump on our website and have a look at the funding outline and what you need to do for it. I've looked at the sort of the application at the back end of it. It's pretty simple and it's pretty clear what you need to do. So please jump on and put in your applications. If you've got any queries, also on the Shelter website is an email address that you can pop any queries through to, and that'll come through directly to us and we get back to you on that. But in the meantime, I will respond to you all about Neve's question on whether we can backtrack on any of the dates of any of the receipts, and I'll let you know as soon as I can. Cool. Okay. Thank you very much, everyone. Really appreciate your time and look forward to meeting you all, everybody that I haven't met yet, face to face. And yeah, good luck with the application process. It won't take much of your time. Thanks, everyone.
Thanks, Kath.